What is asthma? Asthma is a long-term inflammatory disease of the airways of the lungs. It is characterized by variable and recurring symptoms, reversible airflow obstruction, and easily triggered bronchospasms. Symptoms include episodes of wheezing, coughing, chest tightness, and shortness of breath. These may occur a few times a day, or a few times per week. Depending on the person, asthma symptoms may become worse at night or with exercise. Asthma is thought to be caused by a combination of genetic and environmental factors. Environmental factors include exposure to air pollution and allergens. Other potential triggers include medications, such as aspirin and beta blockers. Diagnosis is usually based on the pattern of symptoms, response to therapy over time, and spirometry lung function testing. Asthma is classified according to the frequency of symptoms, forced expiratory volume in 1 second (FEV1), and peak expiratory flow rate. It may also be classified as atopic or non-atopic, where atopy refers to a predisposition toward developing a type 1 hypersensitivity reaction. There is no cure for asthma. Symptoms can be prevented by avoiding triggers, such as allergens and irritants, and by the use of inhaled corticosteroids. Long-acting beta agonists (LABA) or antileukotriene agents may be used in addition to inhaled corticosteroids, if asthma symptoms remain uncontrolled. Treatment of rapidly worsening symptoms is usually with an inhaled short-acting beta-2 agonist such as salbutamol and corticosteroids taken by mouth. In very severe cases, intravenous corticosteroids, magnesium sulfate, and hospitalization may be required. In 2015, 358 million people globally had asthma, up from 183 million in 1990. It caused about 397,100 deaths in 2015, most of which occurred in the developing world. Asthma often begins in childhood, and the rates have increased significantly since the 1960s. Asthma was recognized as early as ancient Egypt. Asthma signs and symptoms. Asthma is characterized by recurrent episodes of wheezing, shortness of breath, chest tightness, and coughing. Sputum may be produced from the lung by coughing but is often hard to bring up. During recovery from an asthma attack exacerbation, it may appear pus-like due to high levels of white blood cells called eosinophils. Symptoms are usually worse at night and in the early morning or in response to exercise or cold air. Some people with asthma rarely experience symptoms, usually in response to triggers, whereas others may react frequently and readily and experience persistent symptoms. A number of other health conditions occur more frequently in people with asthma, including gastroesophageal reflux disease (GERD), rhinosinusitis, and obstructive sleep apnea. Psychological disorders are also more common, with anxiety disorders occurring in between 16 to 52% and mood disorders in 14 to 41%. It is not known whether asthma causes psychological problems, or psychological problems lead to asthma. Those with asthma, especially if it is poorly controlled, are at increased risk for radiocontrast reactions. Cavities occur more often in people with asthma. This may be related to the effect of beta-2 agonists decreasing saliva. These medications may also increase the risk of dental erosions. Asthma causes. Asthma is caused by a combination of complex and incompletely understood environmental and genetic interactions. These influences both its severity and its responsiveness to treatment. It is believed that the recent increased rates of asthma are due to changing epigenetics, heritable factors other than those related to the DNA sequence, and a changing living environment. Asthma that starts before the age of 12 years old is more likely due to genetic influence, while onset after age 12 is more likely due to environmental influence. Environmental. Many environmental factors have been associated with asthma's development and exacerbation, including allergens, air pollution, and other environmental chemicals. Smoking during pregnancy and after delivery is associated with a greater risk of asthma-like symptoms. Low air quality from environmental factors, such as traffic pollution or high ozone levels, has been associated with both asthma development and increased asthma severity. Over half of cases in children in the United States occur in areas when air quality is below the EPA standards. Low air quality is more common in low-income and minority communities. Exposure to indoor volatile organic compounds may be a trigger for asthma. Formaldehyde exposure, for example, has a positive association. Phthalates in certain types of PVC are associated with asthma in both children and adults. While exposure to pesticides is linked to the development of asthma, a cause and effect relationship has yet to be established. The majority of the evidence does not support a causal role between acetaminophen, paracetamol, or antibiotic use and asthma. A 2014 systematic review found that the association between acetaminophen use and asthma disappeared when respiratory infections were taken into account. Acetaminophen use by a mother during pregnancy is also associated with an increased risk of the child developing asthma. Maternal psychological stress during pregnancy is a risk factor for the child to develop asthma. Asthma is associated with exposure to indoor allergens. Common indoor allergens include dust mites, cockroaches, animal dander, fragments of fur or feathers, and mold. Efforts to decrease dust mites have been found to be ineffective on symptoms in sensitized subjects. Weak evidence suggests that efforts to decrease mold by repairing buildings may help improve asthma symptoms in adults. Certain viral respiratory infections, such as respiratory syncytial virus and rhinovirus, may increase the risk of developing asthma when acquired as young children. Certain other infections, however, may decrease the risk. Hygiene hypothesis. The hygiene hypothesis attempts to explain the increased rates of asthma worldwide as a direct and unintended result of reduced exposure, during childhood, to non-pathogenic bacteria and viruses. It has been proposed that the reduced exposure to bacteria and viruses is due, in part, to increased cleanliness and decreased family size in modern societies. Exposure to bacterial endotoxin in early childhood may prevent the development of asthma, but exposure at an older age may provoke bronchoconstriction. Evidence supporting the hygiene hypothesis includes lower rates of asthma on farms and in households with pets. Use of antibiotics in early life has been linked to the development of asthma. Also, delivery via caesarean section is associated with an increased risk, estimated at 20 to 80%, of asthma. This increased risk is attributed to the lack of healthy bacterial colonization that the newborn would have acquired from passage through the birth canal. There is a link between asthma and the degree of affluence, which may be related to the hygiene hypothesis, as less affluent individuals often have more exposure to bacteria and viruses. Genetic. Family history is a risk factor for asthma, with many different genes being implicated. If one identical twin is affected, the probability of the other having the disease is approximately 25%. By the end of 2005, 25 genes had been associated with asthma in 6 or more separate populations, including GSTM1, IL-10, CTLA4, SPINK5, LTC4S, IL4R and ADAM33, among others. Many of these genes are related to the immune system, or modulating inflammation. Even among this list of genes supported by highly replicated studies, results have not been consistent among all populations tested. In 2006, over 100 genes were associated with asthma in one genetic association study alone. More continue to be found. Some genetic variants may only cause asthma when they are combined with specific environmental exposures. An example is a specific single nucleotide polymorphism in the CD14 region and exposure to endotoxin, a bacterial product. Endotoxin exposure can come from several environmental sources, including tobacco smoke, dogs, and farms. Risk for asthma is determined by both a person's genetics and the level of endotoxin exposure. Medical conditions. A triad of atopic eczema, allergic rhinitis, and asthma is called atopy. The strongest risk factor for developing asthma is a history of atopic disease, with asthma occurring at a much greater rate in those who have either eczema or hay fever. Asthma has been associated with eosinophilic granulomatosis with polyangiitis, formerly known as Churg-Strauss syndrome, an autoimmune disease, and vasculitis. Individuals with certain types of urticaria may also experience symptoms of asthma. There is a correlation between obesity and the risk of asthma, with both having increased in recent years. Several factors may be at play, including decreased respiratory function, due to a buildup of fat, and the fact that adipose tissue leads to a pro-inflammatory state. Beta blocker medications such as propranolol can trigger asthma in those who are susceptible. Cardioselective beta blockers, however, appear safe in those with mild or moderate disease. Other medications that can cause problems in asthmatics are angiotensin-converting enzyme inhibitors, aspirin, and NSAIDs. Use of acid-suppressing medication, proton pump inhibitors and H2 blockers during pregnancy is associated with an increased risk of asthma in the child. Exacerbation. Some individuals will have stable asthma for weeks or months, and then suddenly develop an episode of acute asthma. Different individuals react to various factors in different ways. Most individuals can develop severe exacerbation from a number of triggering agents. Home factors that can lead to exacerbation of asthma include dust, animal dander, especially cat and dog hair, cockroach allergens, and mold. Perfumes are a common cause of acute attacks in women and children. Both viral and bacterial infections of the upper respiratory tract can worsen the disease. Psychological stress may worsen symptoms. It is thought that stress alters the immune system, and thus increases the airway inflammatory response to allergens and irritants. Asthma exacerbations in school-aged children peak in autumn, shortly after children return to school. This might reflect a combination of factors, including poor treatment adherence, increased allergen and viral exposure, and altered immune tolerance. There is limited evidence to guide possible approaches to reducing autumn exacerbations, but while costly, seasonal omalizumab treatment from 4 to 6 weeks before school return may reduce autumn asthma exacerbations. Thanks for watching our video. Make sure you subscribe to receive more video related to asthma treatment and many other everyday health and wellness. Don't forget to leave a comment, hit the like button, and share our video. Thank you so much for watching. Be safe, and stay healthy.